A birth plan or birth preferences is a written document that outlines your preferences, wishes, and goals for your labour and the birth of your baby. Think of your birth plan as a communication tool between you, your birth companion, your healthcare providers, and it's going to help to ensure that everyone is on the same page regarding your preferences and desires for your labour, the birth of your baby, and even your postpartum care. While a birth plan is not a binding contract, nor is it set in stone, it does provide valuable information to guide decision making and support your autonomy and empowerment during childbirth. Key components of a birth plan typically include your labour preferences, so labour positions and movements that you'd like to use during your labour for comfort and for pain relief, what relaxation techniques, breathing exercises and coping strategies you'd like to use during your labour, as well as your preferences for mobility, such as whether you'd like to walk, stand or use a birth ball. It will also include how you would like to manage labour pain. So it might list your preferences for pain relief methods such as natural techniques, for example, using some massage or hydrotherapy, or medical interventions that you are open to using such as maybe epidural or other types of pain relief. Now, it can also include specific preferences for pain medication, so including the dosage, the timing, and any alternatives. Next, your birth plan can include a list of support people or individuals who will provide support to you during labour, such as your partner, a birth companion, doula, friends, or family members. It may also list instructions for the roles and responsibilities of support people during your labour and birth. Next, it will detail the type of birth environment you would like to labour and give birth in, including your preferences for the birthing environment, such as lighting, type of music you'd like to play, aromatherapy use, and your desires regarding privacy, quietness, and minimal interruption during your labour and birth. Your birth plan should also cover medical interventions, listing your preferences for routine medical interventions such as fetal monitoring, vaginal exams, and amniotomy, so breaking the waters. You can also include instructions regarding the use of medical interventions, including the circumstances under which they are acceptable, when you would like maybe more time to think about them first, and what you don't want. Also include your preferences for a caesarean birth, including desires for your birth companion or partner involvement, anesthesia options, and immediate skin-to-skin contact with your baby, as well as delayed cord clamping if applicable. Now, a birth plan can also include preferences for the care of your newborn, including skin-to-skin contact after birth, delayed cord clamping and starting breastfeeding, as well as your desires for newborn procedures, such as giving your baby the vitamin K injection, eye ointment, and circumcision if applicable. Include your postpartum preferences for postpartum care, including rooming in with your baby, so always having your baby in your room with you at all times, what you would like with regards to breastfeeding support, and postpartum pain management options. As well, include instructions for any postpartum procedures such as newborn screening tests and vaccinations. And you can include a section, well, you should include a section for emergency situations or unexpected outcomes, including your preferences for resuscitation, neonatal intensive care, and maternal health interventions. Remember to stay flexible and open when it comes to your birth plan or preferences. Labour and birth is very unpredictable, and you may need to adapt your birth plan based on medical needs or unforeseen circumstances. So to summarise, your birth plan should be personalised to reflect your individual preferences, your values and priorities for labour and birth. Make sure that you discuss your birth plan with your healthcare providers, seek their input and guidance, and ensure that everyone involved in the birthing process is informed and supportive of your choices.